Good afternoon, Durham. I'm Jenkins, Director of the Durham County Department of Public Health. It's been a while since I last shared a video message with you, but I feel that this is the right time to address you and discuss the new vaccine group, as well as where we are in our COVID case rates here in Durham. First, good news about vaccinations. As of last week, COVID-19 booster shots are approved for kids as young as 5 years old, and we are now offering these shots here in our clinic. These shots are available for kids 5 months after the second dose of their primary COVID-19 vaccine series. We urge you to come and get your kids vaccinated as soon as possible. These boosters are safe and highly effective. We continue to offer all other brands and doses of COVID vaccines. Whether first doses for all people 5 and older, to second booster doses for people who are 12 and 49 and immunocompromised, or 50 years and older, regardless of their health status, we have a vaccine for you. Our clinic is open Monday through Fridays. No appointment is needed. Visit our website at decopublichealth.org/COVID vaccines for more details. We urge you to get all vaccination doses you're eligible for as soon as possible. Next, where are we in terms of cases in Durham today? As of now, our COVID community level in Durham is in the orange, meaning the high category. The CDC determines community level through a combination of case rates, new COVID-19 hospital admissions, and staffed inpatient beds in use by COVID-19 patients, all per 100,000 population over the past 7 days. By monitoring these metrics, we can see that our case counts have decreased in the past week, but we are now at about 11.3 COVID-19 hospitalizations per 100,000, which is just past the CDC's threshold of 10. We are still, however, well below the CDC's 10% threshold of staffed inpatient beds occupied by confirmed COVID patients, as this percentage in Durham is currently at less than 5%. In other words, although our case numbers are below what they were at other times, such as the peak of the original Omicron surge, COVID is not over. As we continue to work to bring our case numbers down, now's the time to follow our tried and true safety measures. Please consider masking indoors, making sure you are up to date on COVID vaccinations, and limiting your indoor gatherings. But if you do have to gather indoors, take steps to do it as safely as possible. Consider wearing masks when possible. Improve ventilation by opening windows or using a portable air filter, and encourage guests to get tested in advance. We know that many of you are doing these things, and we commend your efforts. Speaking of testing, as we continue to monitor and report our case trends in Durham, many of you have asked if or how home tests are reported in our data. Unfortunately, there is no way for us to track home test results. If you have tested positive at home and would like to be sure this data is reported in our case counts, please visit one of our many testing sites available throughout Durham, like our free testing locations at El Centro Hispano or the Fidelity Investments RTP campus. If you do test only at home, please remember the CDC's guidance for what to do next. If you test positive on a home test, follow isolation and quarantine guidelines, just as you would if you tested at a testing site. If you test negative on an at-home test, this doesn't immediately rule out an infection. Consider testing again 24 to 48 hours later in order to be sure the test did not miss an infection. As always, if you have symptoms, stay away from others. Finally, we know many of you are wondering if Durham will reinstitute mask mandates. The answer is not at this time. Public health is providing the guidance you need to remain safe. Although we are currently in the orange community level, we have already begun seeing decreases in our case per 100,000 population, a key metric used by the CDC to determine community level. We know that as we work to continue to work through this pandemic, we will often see fluctuations in case rates. And as always, we and the CDC encourage you to wear masks when possible at times of case growth. But we are not at the point of recommending to the city and county officials to implement a mask mandate at this time. Please know that if we do reach a period of sustained high case rates, we will work with our city and county leadership to recommend a new mandate when needed. Remember, even if you choose not to wear a mask, there are many good reasons those around you may choose to mask up, like if they are immunocompromised, have been exposed to COVID, or simply feel more comfortable. In short, Durham, we are not where we would like to be with our case numbers, but we are a long way from where we once were. Please don't get too comfortable. Although we are in a much better place than we were months ago, and this has allowed us to relax some of our COVID safety measures, the pandemic is clearly not over. We are still in the midst of a pandemic, and all people can become sick with COVID-19, even if you already had COVID in the past. The best way to protect yourselves and others is through a combination of vaccination, masking when needed, and other measures like avoiding indoor gatherings or making them as safe as possible through ventilation. Stay prepared. No one method alone will end this pandemic right now. As we head into the long weekend and the weeks and months ahead with COVID-19, please remember this message and don't believe that we are post-pandemic. By making these smart, well-tested decisions to protect yourselves and those around you, I know that we can do this, Durham.